276,000 deaths and more than 3.9 million infected people till date, all due to an incredibly small virus, COVID-19. Biggest challenge to humans and to the technology as well. So the big question arises, will the technology save the humanity or not? Hello and namaste. It's me Samarjana Mahatra, mechanical engineering student at Purvanchal campus Thoran, trying to put my ideas at X-Tech IDEAT on the topic, role of technology in pandemic response. Disease experts use the term pandemic when the new infection spreads to multiple countries and continents, at the same time affecting many people. WHO decides whether to use pandemic by evaluating three things. First, the geographical spread of the virus. Second, the severity of the disease caused by the virus. And lastly, the societal impact of the virus. Studying these three factors, WHO declared coronavirus a pandemic disease in March 2020. The full form of COVID-19 is Coronavirus Disease 2019. Advancement in medicine, communication and technology decreases the mortality rate of a pandemic disease. The first and foremost role of technology in pandemic response is to find the vaccine against the pandemic. As soon as China released the genetic sequence of the virus in January, work on the vaccine began, and currently there are 115 plus teams of researchers from about 21 countries all around the world working for the vaccine. All thanks to technology that 7 teams have reached the first phase of human clinical trial. This has now been an international race of science and technology for the vaccine. Leaving the hope of vaccine in the hands of science and technology, we must prepare what worse the COVID-19 brings to us. Before putting my ideas on what role of technology can respond against pandemic disease, let's have a quick overview on use of technology by other countries during the fight against the pandemic coronavirus. A Chinese robot named Pepper, built by Beijing startup company Cloud9, is being used in the hospitals at the virus epicenter, as robots don't carry virus. Drones are on the front line in China, delivering lab samples, medicines and also urging people to wear masks. Face tracking machines, softwares, infrared cameras are now identifying potential patient of coronavirus in China. Similarly, in Hong Kong, people arriving at airports have been given electronic bracelets containing Bluetooth module so that the authority will check if they are staying home. And now, here I present my idea. Big data and information has become the best preventive effort during any pandemic. There are different contact tracing mobile applications like Trace Together, which uses an algorithm to help find the people who were in direct contact with COVID-19 patients. These mobile apps and softwares has decreased the speed of virus by drastically reducing the time for contact tracing. According to 2076 MIS report of Nepal Telecommunication Authority, about 63.31% of the total population of Nepal is accessible to the internet. Other reports from the Kathmandu Post and the Nepal.com has shown that smartphones users had just crossed 50% of the total population of Nepal. Sad but obvious fact that due to inaccessibility of smartphones and internet services to majority of Nepalese people, data collection and contact tracing of COVID-19 patient through these Android mobile applications could be inaccurate and misleading. So no any mobile application system can be effective for this context. Nepal currently has 3 major telecom operators: Nepal Telecom NTC, Ncell and Smartcell. If Nepal government collaborates with these telecom operators, among which 91.49% share of NTC, the largest telecom operator, is owned by Nepal government itself, collection of data and information would be effective and accurate by IVR technology. So what is an IVR technology? IVR, Interactive Voice Response, is a technology that allows a computer to interact with human through the use of voice and telecommunication signaling input via keypad. In telecommunication, IVR allows audience to interact with the host system via telephone keypad or by speech recognition, after which service can be inquired about through the IVR dialogues. A practical example is the IVR system used for a customer service center by dialing 1414 in NTC. Currently, NTC, Ncell and Smartcell are using this IVR for telecommunication services, but we are not using IVR services in medical and surveying application, although it has a wide application in medical and surveying. So, how does it work? Concerned authority can collect data and also conduct contact tracing by retrieving the information given by the citizen compulsorily through their mobile phone. Smartphones and internet are not required. Firstly, the installation of IVR should be done such a way that IVR options should consist of: are you safe? Are you quarantined? Are you having a fever? Did you receive the pandemic relief packages? Is anyone sick nearby? Is anyone selling goods expensively? And many other. The telephone users individually provide information which gets directed to respective authority. Mainly, this information can be directed to respective rural municipalities, which are 416 numbers, municipalities which are 276 in numbers, and 77 district hospitals. Then the further action can be taken on time. For contact tracing around pandemic hotspot, special IVR option can be added. Whom did you meet today? These days, when we try to call anyone, we receive the awareness voice clip before the call. Same way, we can set up this IVR setting around the call, or maybe at certain allocated time, but it must be carried out every day. From this method, hospitals can get patients immediately, contact tracing can be done, victims can get relief packages, illegal marketing will stop, information can be recorded on daily basis, and mainly the spread of a pandemic will reduce. IVR system is very cheap. It can be easily installed on a public switch telephone network and highly effective. According to 2076 MIS report of Nepal Telecommunication Authority, there are 3,99,88,752 mobile users in Nepal, which means almost every Nepali citizen uses mobile phone. So having a simple mobile phone using IVR, almost entire people of the country will be reached. And due to this reason, the IVR system can be effective response to the pandemic. Thank you.